This is the ACJoint Injection Lab workshop for the first year class, musculoskeletal module. The goals include learning landmark guided injection of the AC joint as well as ultrasound guided injection on the cadaver. Steps of injection included placing the needle, removing the stylet, attaching the tubing, then injecting 1.5 mL of latex solution. Landmark guided AC joint injection is performed in 3 steps. But first, a quick review of the anatomy. The acromion is an extension above the glenohumeral joint from the scapula, forming the acromioclavicular joint with the distal end of the clavicle. Step 1. Palpate the margins of the AC joint with your fingers. First, place one finger on the distal end of the clavicle. Place the second finger on the proximal acromion. The second step is to place your needle vertically between your fingers into the joint. Step 3 is to remove the stylet, attach the tubing, and to place your latex mixture into the joint. Part 2 of the lab, ultrasound guided injection of the AC joint. Here are the 5 steps to successful placement of the needle and latex mixture. Step 1 is the same as the landmark guided. Palpate the bones of the AC joint with your 2 fingers. Step 2, place the transducer coronal to the body over the AC joint. Step 3, make sure that your depth of field is minimized on the screen. In this example, the total field depth is 3 centimeters noted on the right side of the screen. Distal end of the clavicles on the left, proximal acromions on the right, and the joint space is superior and in between. The arrows are outlining the top of the joint capsule, exhibited by a hyperechoic line. In the actual patient, you can ask the subject to shrug their shoulder, seen here on this video. In-plane needle guidance requires that the needle is in plane with the transducer. The needle shaft is noted with the arrow to the left showing the needle tip. Step 4, place the needle in plane into the capsule. In this video, the left AC joint is being approached by the needle from the right side of the screen, and you can see the needle approaching and entering the mid portion of the capsule. Step 5, inject the latex with real-time ultrasound imaging. Here's a patient example. Hyperechoic steroid mixture is exhibited and dispersing to the superior aspect of the capsule. We are now evaluating a right AC joint where the left side of the screen is lateral. The video exhibits flow to the inferior aspect of the joint between the acromion on the left and the clavicle on the right. Same patient on the left side, needle approaching laterally from the right side of the screen into the capsule of the joint. Here's a quick review of the steps for both landmark guided and ultrasound guided AC joint injections. For this and other videos, feel free to go to my YouTube channel, Duplichan Musculoskeletal Ultrasound.